In my union, for the Ontario Nurses Association, we have a significant number of nurses who are being laid off. They were called nurse liaisons. And these nurses were professionals who worked very closely with the physician, ensuring that patients had appropriate testing done, did a lot of the discharge planning, worked with the nurse, worked with the patients and the patients' families and the physicians to kind of get it all together so that we could safely discharge that patient into the community or into a retirement home or a nursing home, and the services were going to follow them. So these nurses are being eliminated. Their positions are being eliminated. So I have no idea who's going to be doing that work. The expectation is that the physicians are going to be responsible for their own patients. I have been told that the expectation will be that the registered nurse at the bedside will be responsible to ensure that all discharge planning is completed. As a registered nurse, I work in the intensive care unit. Believe me, I find it very disconcerting to be able to be responsible for all discharge planning for a patient who is being discharged from the intensive care unit, because I may have one or two patients. I'm fortunate. Think of the nurses who work on the inpatient units. During the day shift, they will have a 4-to-1 ratio, so they'll have 4 patients they're responsible for. These are 4 very sick patients, because we do not see stable patients in the hospital. We have sick people. And planning discharge, this is not, Mr. Donaldson, you can go home today. This is, Mr. Donaldson, we think your mother is ready to be discharged. We need to set up the following appointments. You are going to have to ensure that all these things are put in place in order to safely send that person home. It's going to, yes, I believe it's going to increase the workload. And I'm very concerned that we are going to have patients who will fall through the cracks. And as a registered nurse, and as the other professionals here sitting at the table, that is the absolute last thing we want to see happen to our patients. They don't deserve that. And I just want to qualify as well that I have approximately 15 nurses who are being laid off so that the employer can create more middle management. So they're taking away nurses from the front line to create more managers, assistant managers, to help the managers.
What kind of managers are you talking about?
Assistant managers to the inpatient units. So best part is that as a registered nurse, we will be expected to take on, we do take care, do the full care of our patient, and we take great pride in that. The expectation is that we will ensure that all discharge planning is done. We are supposed to be working very closely with the physician. The nurses who are being laid off, they were called care facilitators, or their positions are being laid off. These are similar to what used to be called the team leaders. They would oversee the activity in the unit and ensure there was good flow of the patients, ensure that everybody was getting the necessary services provided, and just overseeing everything, because there's a lot of activity that goes on in a 36-bed unit. And as a nurse who's looking after my 4 patients, I may not necessarily know what's going on in the rest of the unit. So those people are going to be taken away. They're going to hire assistant managers. I can only presume to potentially be in the position of having to discipline us when we can't provide all those services.
Are you when you say managers, are these nurses, or these are management people?
They'll be management people.
Non-medical.
They will be management people. I do not know who the employer plans on hiring. I only know that they're eliminating those positions in order to hire assistant managers.
I represent the support staff at the Ottawa Hospital. And like Ona, we are also losing 52 registered practical nurses. So we're losing some nursing staff too. We're losing some orderlies. We're losing some clerical staff. And then they're talking about reduction of hours in the cafeterias because it's not making a profit. I didn't know. I wasn't aware that cafeterias were supposed to make a profit. I thought they were actually there for the purpose of a family member to go down and get something to eat while their sick family members were in the hospital. So I wasn't aware it was for profit for cafeteria people. again, the same thing. We've had 250 plus layoffs in the last couple of years, so this is not something that's new. It's they make it sound like this is a new event, but we've already lost 250 equivalent of what they call FTEs, full-time equivalents, over the last 2 years. We're still going through a chain from last year where they've wiped out all the medical transcriptionists now, and they're basically gone to a voice recognition system. So we've lost 50 people there last year that are still going through the chain. We still haven't dealt with them. We're still not finished dealing with them. We're still dealing with some orderly losses from 2010. So this has been an ongoing thing, and we, with the way the funding formula is now from the Liberal government, we see more cuts coming in the future. This is just the start of a big 5-year wave, we believe, because every year they're going to have to basically have a zero balance in their budgets, and the only way to zero balance your budget is to cut. And so this is just going to steamroll into more cuts over the next 3 to 5 years. I do want to say that that was a misquote. I'm hoping that Dr. Kiss was misquoted, because there is not 600 vacancies. If there was 600 vacancies, we wouldn't be here today. They would have just been able to wipe that money right out of the budget if there were 600 vacancies that they didn't need. So that's not a true statement.
My folks provide treatment, help provide therapy, aid in diagnostic testing for the patients of the hospital. We already have workload reports where some disciplines are not able to fulfill the requests of the physicians for the inpatients to see the patient before they're discharged. So some of them are going home without some of that support that would have been preferred, what was asked for by the physician. Discussion of support in the community, the province hasn't stepped up to the point where the community can take over. So far, I've received a list of 30 positions. Apparently, I'm supposed to hear about 100, so I have more bad news coming. Their hospital's working on a review currently of ambulatory care, which essentially is outpatient work, that they may choose to reduce or not participate in altogether. So there's more resources or more work potentially deployed to the community that is unable to, the waiting list in the community will grow because they'll be taking on more work that currently the Ottawa Hospital is providing. The challenges are unprecedented. The province of Ontario needs to look at the impact on healthcare. We're just starting to see the graying baby boomers start to access care, and that wave is going to continue increasing for the next little bit, and we're in no shape to look after it.